The first thing that we recommend doing is having yourself set up. That way, when you're ready to do the change, it's kind of a 1, 2, 3, you're all set to go. So here are all the materials that come from the G-Tube kit. You will have all of the equipment that you need to place the G-Tube, replace the G-Tube, or check the water in the balloon. So inside you will find your G-Tube button. And you'll notice that there's some numbers written on this G-Tube, which is important because this helps us know the sizing, and it will also give us information about how much water you need to place into the balloon. The top number will say FR, which stands for French, and the bottom number says CM, which is centimeters. So that tells us how wide and how long the G-Tube is. And this is a custom sizing fit for your child. On the other end, you'll see BAL, which stands for balloon. This tells us the amount of water we would need to place into the balloon to keep it secured once it's in place. You will find a little blue stylet, and this actually gets inserted inside of the G-Tube right before you insert it so it doesn't bend. You will have your syringe, which has a special end to it that fits into your balloon opening of the G-Tube. A packet of lubricating jelly, which will be placed on the end of the G-Tube to help with insertion. A larger syringe that you can use to check for stomach content once the G-Tube is placed. And you have 2 sets of extension tubing. One is your right angle connector, which you would use to administer medications or feedings, and the other is a straight set, which you would use for venting.